Okay, so the next stage on, we're looking at helping to manage chronic lower back pain. Also, with injured areas, we need to look at, I think a good strategy is to look at what's above and what's below it. So with lower backs, obviously, tight hips, which we kind of looked at with the recovery position, we're trying to get them open, that help below the lower back. But we also need to look at what's happening above it in the thoracic area, in your upper back. So obviously if your clients are kind of stuck in a rounded position, obviously that's and their centre of gravity is off, obviously the lower back's got to do a lot more work to try and kind of pull them more upright. So if we can kind of stretch out and reset that upper back, that's going to help take some pressure off the lower back as well. So this is especially good for clients, or if you're the sort of person who sits down all day at an office desk type job, or really beneficial if you do a lot of travelling in aeroplanes, because you really have a really upper tight back where you're locked in that still position for hours on end and not moving. So what we need, or one of the best places to start, what we need is a foam roller. So we get it lined up with all those shoulder blades. Take our hands behind our head, take a deep breath in, let it out, and then just very gently, we're going to stretch back as far as we feel comfortable. And then we might come up, maybe move a little bit higher, same again, let her in, let it out gently, let our arms just stretch back, and gently start to get some more movement and mobility into the upper back. So what you might find, if your back's very, very stiff, is you may get a few kind of adjustments, almost like chiropractic adjustments, like you'll feel things kind of start to click around. But more than anything, just want a nice gentle stretch. And that's obviously why it's got to be gentle. I see a lot of people just throw themselves into almost like a stomach crunch to come up. It's a completely wrong idea. The whole idea is that nice gentle, let the air out, let the back very gently start to stretch out. And that's the most important thing. A lot of these mobility drills or warm-ups for lower back, chronic lower back pain, is you have to be gentle and you have to encourage ranges of motion and improvements, not try and force them. Because the second you try and force something, the muscle's going to tighten up and you're going to lose that benefit straight away. So obviously this is one of the easiest ways to start. And just, if you do it, you get a foam roller for home, if you do work in an office, as soon as you get home from work, you can spend 5-10 minutes just giving your upper back a stretch out, and believe me, you'll feel the wonders for it. Also tends to help with very tight neck, or if you tend to get tight shoulders as well. So if you can mobilise that thoracic gently, you'll see great benefit.